and welcome to our special show. Vydehi Superspecialty Hospital presents Modernizing Medicine. I'm Paromita Chatterjee.
The recent pandemic has changed the way healthcare is approached. With technology playing a pivotal role, there is a need for cutting-edge expertise in modern healthcare. Interventions in medicine aided with technology have made the impossible possible. And herein lies the need for facilities that can cater to every advancing modern medicine.
Let's find out a little bit more with our guest on the show today. We have with us the director of Vydehi Superspecialty Hospital, Bangalore, Dr. Mahesh Babu Kottapalli. What exactly do we mean by critical care? Because that's something that a lot of people, a lot of youngsters are focused on. How would you compare it to what we are seeing elsewhere?
Well, critical care, the term critical care means critical. Critical means crucial, the time. The amount of time that is required for a patient to come into the hospital and from there diagnosing the problem and then treating the problem accurately and appropriately. The time factor is what's critical here. Not a lot of facilities in this country have this, and very few specialty hospitals or big institutions have codes in place and they have protocols in place where they actually have certain rules and regulations as to if this particular diagnosis comes in, this is what needs to be done. So that kind of a critical care is available very limited areas, and one of the reasons is because unfortunately a lot of attention has not been paid during training of the doctors.
So what you're saying is the care is there, but perhaps we don't have...
More training is what we needed.
More training.
More and more training and more specialty fellowships, DMO programs in critical care to be concentrated on these doctors. So when they come out, they bring them with new ideas, and then when they come and start occupying spots in the hospitals, emergency rooms, they can actually train their juniors also into it.
Okay, because I think you brought up a very important point. Critical care specialists were in huge demand, I think, during the pandemic and even after that, given all the healthcare problems. But it's also something which is very expensive, right? But at the same time, we've seen insurance coverage, for instance. People have gone in and bought health insurance in droves, something which wasn't there in India. It wasn't given priority. Has that sort of changed the accessibility curve in terms of more people being able to afford and access this kind of high quality healthcare?
Yes, having health insurance is a must, I would say, for every family. Just like how we have insurance for a car. You never know when you're going to have an accident. That's why you take insurance. Same thing for health. You never know what's going to come. All you need is just walk into your bathroom, slip and fall and hit your head. Boom. That's going to run into lakhs of rupees, that kind of a treatment. So it's always better to have health insurance for every individual in this country. There are programs and schemes that are being provided by the central government for those who cannot afford to buy health insurance on their own. Now, prior to the pandemic, people thought they were invincible, especially the youngsters, and they did not bother investing in that particular health insurance. There are some corporate entities that were actually providing health insurance for their employees, but run-of-the-mill people who are not part of the corporate employment, who are private business, individuals, they did not pay attention enough to look to buy for health insurance. So therefore, when it came time and they got sick and they had to be admitted, they kind of had to put out a lot of money out of their pockets. Right. However, India is one of those countries that has invested highly into healthcare, especially in the form of schemes. We have, for example, we have central schemes, which is Vajpayee Arogya Sri, and we have local government, Karnataka
So people need to have that awareness, whether it's private health insurance or some of these government schemes. Insurance is definitely something that we should all be taking care of.
Yes.
Some great points about health insurance coverage, but now let's talk about emergency care. And it's all about how quickly one responds, especially the healthcare facility, to really in that golden hour period, so to speak. How prepared are we?
Okay, that was a very interesting question that you asked about emergency care. There's emergency room, something called minutes matter. Okay, the reason I say that is because for every particular incident or diagnosis, for example, you take a patient with a heart attack, it's called acute MI. There, the window period is very less because the heart is now strained. It itself is not getting enough blood, so it's going to stop functioning. And once the vital organ like a heart stops functioning, you're done for.
Right.
So when a patient is diagnosed of an acute MI or a cardiac stroke called, the window period is very limited. So we have come up with some protocols called door to cath lab in 30 minutes. That means a patient with an acute MI or a heart attack, as soon as they enter the emergency room, from that moment the clock ticks for 30 minutes. And within 30 minutes, everything is organized and the patient is taken straight into the cath lab and the cardiac catheterization is done, angiograms, stent placement, whatever you have to
So you mentioned an important line, the clock is ticking, because
Yes.
we've all heard of the golden hour.
Yes, that's exactly what I mean is the golden hour is there's not even an hour's time sometimes, you're talking about minutes.
So I think in that sense, doctors here in India are gearing up for that kind
Yes.
of time-bound, quick response within that golden time frame.
Yes, to a certain extent. Okay, because India is such a huge country, unfortunately all the major hospitals are located in their cities. Okay, so in those hospitals, the advanced super specialty hospitals, if some of them have the protocols, some of them don't have the protocols.
So consistency is missing.
Exactly.
Because I mean, I was going to come to my next question, which is about the whole skewed, doctor-patient ratio. Possibly we have one of the most adverse ratios in the world. I believe there are 1,500 patients to one doctor. What's the solution to this then?
Well, the solution is not that hard. For example, the state of Karnataka has made it mandatory for these interns who pass out of MBBS and for PGs after the post-graduation, 1 year mandatory service in rural areas.
Right.
Now imagine on a yearly basis that thousands of MBBS, thousands of postgraduates who are graduating, and all of them have to go and serve for 1 year in the rural areas. Even 1 year they do and they leave, another batch comes in, another batch comes in. Thousands of people are graduating.
Right.
And it's an excellent incentive done by the state of Karnataka, and I hope the rest of the country also takes incentive from them and also implements across the country, then we won't have this problem any further.
Right.
When you have interns and PGs after the graduation go and rotate over there, some might stay back. Looking at the rural areas, looking at the beauty of it, they might just stay back, small village, small towns, who knows? Who never
Maybe
know.
even impose a rule where we have wonderful doctors like you mandatorily coming back to the country.
There you go. So you
took
never
a
know.
step.
You never
Okay.
know what you're going to find unless you visit there.
And now for the other part of the question, now that you've explained corporate hospitals to us, is in terms of demographics. So what kind of demographics do you tend to attract?
In corporate hospital, they generally tend to attract more of the affluent population, looking at upper middle class and people who have insurance, people who work in corporate sectors by themselves, and also private people who don't mind paying a little extra to get the facilities that they don't have in your so-called traditional hospitals.
So my next question is about healthcare professionals, whether it's doctors or nurses. It's a very competitive landscape. So how do you retain, these kind of healthcare professionals for a particular institution? Is it a huge challenge?
It's absolutely a huge challenge, especially doctors. They're a special breed, and they spend most of their youth studying, be it MBBS, PG, or what have you, super specialty after that. By the time they come out, they're in their early 30s. Okay, and they come out with a degree and they demand and command respect. Any institution that wants to be successful and want to retain doctors, there are only 3 things that you have to do. One is make sure the doctors are financially taken care of. Okay, that's number 1. Number 2 is they are respected and treated very highly. And third thing is involve them in their policy making decisions of the administration.
Okay, that's the secret that has finally been shared. Let's continue with more of these thoughts. Technology has really been a game changer for the healthcare industry. How has it played out for hospitals in particular when it comes to, AI, deep tech? analytics, Internet of Things?
Let's step back a few years, 10, 20 years back. If you went to a clinic or a hospital and you give a blood sample or a pathology sample or whatever sample you give, we had to wait 3 days, 4 days, a week to get a report. Even getting an MRI, CT scan that time would take a few days. Fast forward now, with the latest technology and the information technology we have, the IT programs we have and the equipment that we have, it's in minutes. Before, we had a human looking into the microscope, taking a pen, writing it on a piece of paper, and then verifying it. Now, you just take the sample, just stick it in the machine. Within a few minutes, the machine is spitting out accurate results.
So clearly it's speeded up things.
It has speeded up things to an advantage, because before a patient would come in, we would take a sample and wait for the reports to come back to start our treatment process. Now, when the patient comes in, we do some kind of a guesstimate treatment, and then within a few minutes we get the reports back. Accurate treatment is given much faster, having better patient outcomes.
And what about in terms of analytics, for instance, or even integration of data? Because it's said that healthcare perhaps generates the maximum amount of data because of all the patient touch points.
Well, data is definitely out there, but each hospital system has its own software, and they don't talk with each other. Okay, so your data is now limited to your own hospital. Now, fortunately, they have a lot of apps that have come out in the market, and they are the ones who are actually capturing this data and trying to market it and sell it to the hospitals for benefit of the patient or benefit of their own business strategies. But data is definitely out there, and if used appropriately, it can bring out great results.
In fact, another aspect of technology is this whole concept of teleconsultation, for instance, or just remote consultation. Before I talk about the broader teleconsultation and that sphere, home care and this whole aspect of remotely taking care of patients, patients who are at home. How do you think technology has been a game changer? Really, for instance, for patients who are sent home and you really want to regularly monitor and keep in touch with them?
Well, that's two different questions you're asking. One is telemedicine, which is a question by itself. And home health is another issue by itself. So let me tackle the first one, which is telehealth. It came out a few years ago. It was not very exciting, let me put it this way, because it was mostly for access of rural patients to some specialists who are located in the cities.
But the pandemic changed all of it.
Yeah. Then came in the pandemic, and that's when the telemedicine really took off, because patients were afraid to come into the clinics, patients were afraid to come into the hospitals to see doctors over here for outpatients. That's when this new thing opened up. It's become huge now. It's an advantage, definitely. The reason is because, let's say a person is diagnosed with diabetes. The first time they come to the doctor, you do a full physical, you don't see much outside anyway. So the rest of them is all monitoring. This patient now is in a remote area or doesn't have access to come in, doesn't have a vehicle, there's no transport for them, or there's nobody in the house to bring them to the clinic. These people are stuck at home. And for them, this is a boon. All they have to do is on their smartphone or the laptop or an iPad, just quickly log in. The doctor's looking at you and you talk to the doctor, tell him your symptoms. He's going to ask you a few questions. If everything goes well, he says, good, here's your prescription. We'll see you back soon.
But this example that you've given us is basically for patients who don't have a choice or who have limited, for instance, logistics. What about for patients or customers who really want to still be in this sort of phygital domain where they want to do some things online, they want to do some things in person, and that includes healthcare as well.
Absolutely.
Do you think that's going to be the future? That's the reality of healthcare?
It is already a reality right now.
Do you think technology is also going to be a huge game changer as far as costs is concerned? And I'm here talking about for those who can't afford perhaps, or who couldn't afford. A lot of the kind of healthcare or doctors prior to these kind of platforms which are now available. Do you think it will make it more accessible for these patients? Or should they look, for instance, at government schemes? I mean, that these kind of insurance backups will always be there to help those not as privileged.
Let's take one at a time.
Okay.
Your first question was, has technology made it more affordable for the patients?
Yeah.
Absolutely. I've noticed that someone has been given a diagnosis and requiring a surgical procedure. The patients are now so smart, they just go and Google and see which facility is providing the cheaper surgical solution for this one. So that's one way they're looking at it. Whoever is the cheapest one, they go there now. Second thing, before, there are a lot of diagnostic procedures being done because of lack of knowledge or what have you. But now the patients have become so smart, they Googled everything, they read about it, the literature out there, and know that if someone's ordering an inappropriate or unnecessary diagnostic test, and they know, hey, I don't need this one, I already read about this.
So in a way, technology has been more of a leveler in terms of knowledge.
They are educating themselves, they become more smarter, and you cannot pull a cloth on their eyes anymore.
Right.
And furthermore, they know what the pricing is going to be, they know how much the MRI or whatever is in this area, how much it's costing, they know the pricing of everything. So yes, technology has made it more affordable for people who were not able to afford before.
And now for the second part of my question, which is, for the underprivileged, how has technology helped them?
Well, let me put it this way. The home health is a concept that has been in place for years together in the Western world. It's now slowly entering this country. The reason is because in the Western world, family support to patients is not very high. Here in India, the families are now close-knit, they have big family, or at least used to be big families, and their extended families helping each other. But now the concept of nuclear families has entered in this country as well, where everybody's for themselves, husband, wife, and kids, that's about it. Right. So there are a lot of patients who don't have good family support, and that's when home health steps in. Especially for patients who had procedures or surgeries done in a hospital. Previously, they would keep them for days together in the hospital. Even if it's not a complicated surgery, they were still keeping them in because they couldn't send them anywhere else. Right. And that led to several things. One, increased cost for the patient because they had to stay here extended time. Second thing is, when a patient stays in a hospital for extended length of stay, they tend to get more infections. Okay, of the surgical side, it's called hospital-acquired infection. That requires more antibiotics, again, more cost to the patient.
So that's completely changed, actually.
That hasn't changed yet. It still has to change. It's a long way to go. And now with intervention of the home health, we are able to send this patient out faster, 2 days after surgery, to their home, into their own comfortable surroundings where they feel psychologically safe. And at the same time, someone's visiting them, changing their dressings, doing physiotherapy, even bathing them, feeding them, what have you. The outcomes are much better, and the patient comes back and visits the doctor in an outpatient clinic.
So clearly that's hopefully will be changing at a more accelerated
information
pace.
Technology is going to play a key role, whereby we have to have software that's connecting the home health with the hospital and the patient and interacting with each other.
So that's what the future is for the privileged. Now, on a final note, let's talk about the underprivileged. And the pandemic or any sort of health calamity usually pushes them onto the brink of poverty because they have to dig in deep as far as their own funds are concerned. Do you think, as far as the government is concerned, we need more policy support to help this segment of society and really change their landscape as far as the future of healthcare is concerned?
Well, I would say that India has already stepped into leaps and bounds compared to other countries as far as providing healthcare at an affordable price for the underprivileged. They have come up with schemes such as Arogya Bhagya and Vajpayee Arogyashri and everything. But the problem here is not a lot of people in the rural areas are aware that, hey, I can avail these schemes for my benefit. Right. This is where the Anganwadi workers come in. They need to be trained more aggressively, and they need to have access to proper digital software in their iPhones or laptops or whatever, whereby they can actually take in the information of the patient, plug in quickly into the system, see if they qualify for their particular thing, which scheme will fit for which patient. And
so you're saying the policy is there, the nuts and bolts of it are there. It's just awareness, and perhaps the Anganwadis and these local health workers, they need to be sort of retrained or
They are
remade?
already trained to a certain extent, but the only problem I would say is providing them with the tools to make things more faster.
Because ultimately it's the speed of response that really determines how effective healthcare is.
Correct.
Okay, great. Dr. Mahesh, we'd love to continue this conversation, but it's been so enriching and such a wonderful meeting in the super specialty environs of Vydehi Super Specialty Hospital. On that note, thank you so much, Dr. Mahesh, for joining us on this special series and educating us about the possibilities in healthcare. And that brings us to the end of the special series. Vydehi Super Speciality brings to you modernizing medicine. Thank you so much for joining us today.